Hello, and welcome to our channel. If this is the first time you are visiting our channel, please consider subscribing. We create and share high-quality and informative medical videos that will help each one of us make healthy choices and decisions in our daily life. We welcome all of you and appreciate your support and encouragement. We are committed to producing more medical videos that will benefit all of us. Thank you. In today's video, we will talk about sleep apnea and sleep disorder. We will cover some of the most critical life-saving tips and information that you need to know about sleep apnea and sleep disorder. Therefore, make sure you watch till the end of this video. So, let's get started. Here are the 6 questions and topics we will be covering in this video. From the answers to these 6 questions, I promise you will surely discover some life-saving facts and tips about sleep apnea and sleep disorder that you need to be aware of. So, here are the questions we will be covering. Number 1. What is sleep apnea? Number 2. What are the 2 main types of sleep apnea? Number 3. How can you tell if you have a sleep disorder? Number 4. What are some foods that you would want to integrate into your diet to help with sleep apnea? Number 5. What are some foods that you would want to avoid when suffering from sleep apnea? Number 6. What are the top 5 reasons you would want to have good sleep regularly? Let's get started answering these 6 questions. Getting high-quality night sleep is just as critical as integrating a healthy diet into your lifestyle and maintaining scheduled regular exercise. Therefore, it is essential to pay attention to how many hours you sleep and the sleep quality you get during a single night. So, let's define sleep apnea. What is sleep apnea? Sleep apnea is a serious sleep disorder that occurs when breathing is interrupted while sleeping. If sleep apnea is left untreated, it can lead to so many health problems, including high blood pressure, stroke, and cardiomyopathy, which is an enlargement of the muscle tissue of the heart. It can also lead to heart failure, diabetes, and heart attack. Also, if you do not get good quality sleep because of sleep apnea, it can lead to social and performance problems. These include job impairment, work-related accidents, motor vehicle crashes, and underachievement in school, especially in children and adolescents. Sleep apnea can be categorized into 2 main types. So, what are the 2 types of sleep apnea? There are 2 types of sleep apnea. It can either be obstructive or central. So, let's get started with obstructive sleep apnea. Obstructive sleep apnea is a more common type of sleep apnea. This type of sleep apnea frequently occurs while you sleep. It can either be episodes of complete upper airway blockage or partial upper airway blockage. After this airways blockage, breathing usually returns with a loud gasp or body jerk. With this blockage, oxygen flow is reduced to vital organs in the body, including your brain and heart. This low oxygen level can affect so many functions in your body, including heart rhythm irregularities, changes in carbon dioxide levels in the body, and it directly affects the heart due to pressure changes within your chest. The other type is central sleep apnea. This type of apnea is not related to a blocked airway. Instead, it occurs when the brain does not signal the muscles to breathe because of instability in the respiratory control center, which is a part of the central nervous system. Note: Sleep apnea can affect people of all ages, including babies, children, adults over 50, and adults who are overweight. As you may know, sleep apnea may lead to a sleep disorder. So, how can you tell if you have a sleep disorder? It is important to note that it is normal to have trouble sleeping every now and then. Here are some common signs of sleep disorder. Number 1. You may not only have trouble falling asleep, but you may have a problem staying asleep as well. Number 2. Frequent loud snoring and periodic pauses in breathing or gasping while sleeping. Number 3. Even though you sleep recommended sleep hours according to your age, you may still feel exhausted after getting up in the morning. Number 4. You may feel sleepy during the day. This can affect your mood and everyday activities, such as difficulty concentrating at work, school, or driving. Now let's move on to talk about the kind of roles food has on sleep apnea. While certain types of food play a significant role in aggravating sleep apnea disorder, other types of food help with sleep apnea, and therefore help you get much-needed sleep. So, what types of food would you want to integrate into your diet to help with sleep apnea? Some of these foods are: Number 1. Types of food that are rich in melatonin. Some types of fruits and vegetables are well known to have high levels of melatonin. Therefore, they are natural sleep enhancers. Some of these vegetables and fruits include broccoli, cherries, asparagus, corn, grapes, and cucumbers. Note: tart cherry juice is known to be the best natural source of melatonin. Number 2. Types of food that are very high in omega-3. Omega-3 fatty acids play a big role in triggering your body to produce melatonin. Seafood is known to be very rich in omega-3 fatty acids, and these include tuna, salmon, and shrimp. Number 3. Tryptophan-rich foods. Tryptophan is an amino acid that can be converted into melatonin when consumed. Turkey is known to be very rich in tryptophan, and that is why you find some people become sleepy after eating turkey, especially on Thanksgiving Day. Some of the other types of food that contain tryptophan are chicken, nuts, and beans. Now we can move on to talk about the types of food you would want to avoid when suffering from sleep apnea. So, what are some types of food that you would want to avoid when suffering from sleep apnea? Some of these foods are: Number 1. Fatty meats. We all know that eating fatty meats can lead to so many health problems. One of them is inflammation throughout your body. This inflammation can lead to cardiovascular problems, which are risky if you suffer from sleep apnea disorder. Some of the fatty meats that we are referring to are burgers, steaks, pork, bacon, lamb, and sausage. This is because they are all high in saturated fats. For that reason, it is best to avoid consuming these types of food, or at least eat them in moderation. Number 2. Bananas. We all know that eating bananas is excellent for your health, especially for your heart and digestive system, when consumed in moderation. This is because bananas are very rich in potassium and fiber. However, when you overeat them, they can increase the mucus production in your mouth and throat, which may affect your breathing, and even exacerbate your sleep apnea. Therefore, make sure you eat bananas in moderation, and avoid eating them before you go to sleep at night. Number 3. High-fat dairy products. Like bananas, dairy products are crucial for your health. This is because they contain much-needed nutrients that our body needs. However, because some dairy products are high in fatty contents, this can increase the mucus production in your mouth and throat. Therefore, it is best to avoid dairy products before you go to sleep at night as well. Note: alcohol can also affect your sleep quality. This is because alcohol can cause your throat muscles to relax, blocking your airway and preventing you from breathing normally. Now that we covered some important information about sleep apnea and how it affects sleep quality. So, what are the top 5 reasons why you would want to have good sleep regularly? The top 5 reasons are: Number 1. Getting poor sleep quality can lead to weight gain. It has been proven that sleep-deprived people tend to have an increased appetite. When you don't get enough sleep, your body makes more ghrelin, which signals hunger in your brain, and less leptin, which is a hunger suppressant, leaving you hungry, and therefore increasing your appetite. Also, not getting enough sleep leads to an increased level of cortisol hormone in your body. This hormone is a stress hormone that may also increase your appetite. Number 2. Good sleep strengthens your body's immunity. You are at risk of being more frequently sick from viruses, including cold viruses, if you don't get good sleep. Also, lack of sleep prolongs your recovery period when you get sick. This is because when your body is not rested, it produces fewer cytokines proteins, which are much needed when you have an infection or inflammation. Moreover, infection-fighting antibodies and cells are decreased when you don't get enough sleep. Number 3. Getting enough sleep motivates you to exercise. Adequate sleep has been proven to help motivate people to adhere to their exercise plans and work out regularly. This is because when getting good sleep, you feel fresh and energized. Number 4. The type of sleep you get regularly affects glucose metabolism, which may lead to diabetes. Limiting your sleep to 4 hours per night may lead to higher blood sugar levels in your system. If left untreated, it can lead to type 2 diabetes. Number 5. Poor sleep quality may lead to depression. Lack of sleep may lead to depression through changes in the function of the neurotransmitter serotonin. Almost all people with depression experience sleep issues. And people who are depressed are prone to suicidal thoughts, and even committing suicide. To summarize, while sleep disorder can lead to so many health problems, including diabetes, cardiovascular disease, and depression, sleep apnea can be life-threatening if ignored. So, it is crucial to seek medical interventions and treatments if you suffer from sleep apnea and sleep disorder. Now it is your turn. What are some other ways to reduce the effects of sleep apnea? What are some techniques that you use to get better sleep? Please share your experience in the comments below. Please don't forget to like and subscribe to our channel. Thank you.